My name is Pat. I was asked to do this, and it became an issue to me, and that's why I wanted to try to help if I could. I became disabled in 2007. Well, not officially. It became unbearable to stand and walk, and due to degenerative disc disease. I went on a medical leave of absence, but still was hoping I could find a doctor that would help me. I went through the process in August of 2007 to go ahead and apply for disability, not knowing how that would go. In the process of this, I lost my home. I had an offer to go to Kansas for a place to live, and proceeded out there, bought for 3 months with an insurance company through my employer, and lived on beans for 3 months. I sought out medical help there, knowing that my insurance had been canceled. I couldn't pay for my insurance. I started racking up bills, and by the time I did finally get the insurance check through my employer, majority of that went to pay medical bills in Kansas. I had applied twice for assistance and for a program through the hospital to see if they would help me. I was turned down. I was told I had just a few $2 too many. So I told myself at that point I would rather die than to keep racking up medical bills that I knew I could not pay. Well, that plan worked for a while. By midsummer, I got sick. Friends in Colorado said, "You need to go see a doctor." I got sick. So I get to the hospital and doctors, and they're going to test me for this, and they're going to test me for that, and their final conclusion after $6,000 of testing is that I need to drive to Denver and have medical care there and have surgeries, but I'm on my own, okay? That means what? I have more medical bills in Denver, in that state, and then I have more medical bills in Kansas, and I won't get any assistance either place. It was a terrifying time. It was humiliating for me. I have never, ever asked anyone for help. I have always been independent, to take care of myself. I've been the caretaker, provider of my whole life. And I do recall, when working, you have your IRS deductions, your estate tax deductions, and your Medicare deductions. Well, because I'm listed as disabled as of 2008, you're not allowed to have Medicaid. And I have to wait 2 years to get Medicare. And I thought, what are you supposed to do? They're telling me no in Kansas, they're not going to help me, but oh, by the way, you have a lot of things wrong with you. Well, it became, between my son and I, we decided maybe I need to get back to Colorado. Maybe there's a program. Maybe there's something there that would help me, or I could get better health care or something. So my son moved me quickly to a friend's house here in Colorado Springs. I got here on a Saturday. I was out on the streets driving around from clinics and places and trying to find out what was available. And before I could even set up an appointment, I ended up in the hospital for about 7 days and ended up with surgery during that time. I had to reschedule and try to get another appointment, and knowing that by December I had to have more surgery. I was already setting close to $60,000 in debt at that point in time. The bills were coming, doctors and offices and this test and that one. They were just piling in, plus the Kansas ones. And again, it was so frustrating. I'm not allowed Medicare. Maybe next January I'll be allowed to have Medicare. No Medicaid. But what do? They deem you disabled. They know you can't keep working. But what do you do for medical care? I would have loved not to have gotten sick. I would have loved to stay as healthy as I used to think that I was at one time. Well, guess what? It doesn't happen. So in the process, I got the program here. Thanks for that. It's for indigenous people. My children were very proud when they heard that. That's what it came to for me. I ended up in the hospital again with another surgery, and 24 hours later back in the hospital again, sick again. Found out Monday I need to have another little surgery, but this won't be quite as serious as the others. People just don't have that guarantee that they're not going to get sick and they won't have to seek out any medical help. It just doesn't happen. There's got to be something. I mean, it's not many Americans are in that position. They're too young to retire. I'm 59 now, but I was 57 at the time I was going through all these